Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. On September 19, 2025, the FDA granted accelerated approval to Elamipretide, marketed as Forzinity. This is a historic milestone, the very first approved treatment for Barth syndrome, a rare and devastating mitochondrial disease. In this video, we'll break down three things: what Barth syndrome is, how Elamipretide works, and the clinical evidence that led to its approval. Barth syndrome is an ultra-rare genetic disorder that almost exclusively affects boys, about 1 in 300,000 to 400,000 births. The condition is caused by mutations in the TAZ gene, which makes an enzyme called tafazin. Tafazin's role is to remodel a unique lipid called cardiolipin, found in the inner mitochondrial membrane. So, what does remodeling mean? When cardiolipin is first made, its fatty acid chains are a bit random, some short, some long, and some stiff because they're fully saturated, while others are bendy because they have double bonds. Imagine trying to build a wall with a jumble of straight rods and bent rods of different lengths. It won't be very stable. That's where tafazin steps in. It swaps out the mismatched fatty acids and replaces them with more uniform chains, usually polyunsaturated linoleic acid. This remodeling gives cardiolipin just the right flexibility and stability to support mitochondrial membranes and energy production. Think of it like a race car. A new car might come with standard tires, but to achieve peak performance, you need specialized racing tires. Tafazin does the same for mitochondria, upgrading their tires so they can generate energy efficiently. Here's the problem. In Barth syndrome, tafazin doesn't work properly. Cardiolipin isn't remodeled correctly, leaving the mitochondria unstable and inefficient. That means poor energy production, especially in the heart and skeletal muscle, the tissues most dependent on mitochondria. Clinically, this leads to cardiomyopathy, muscle weakness, feeding and GI problems, fatigue, and immune problems. Because of its rarity and complexity, there has never been an approved treatment for Barth syndrome until now. Now, let's talk about the breakthrough, Elamipretide. Elamipretide is a small peptide that can enter mitochondria and bind directly to cardiolipin. In Barth syndrome, cardiolipin is unstable because tafazin isn't doing its remodeling job properly. That instability weakens the inner mitochondrial membrane. By binding to cardiolipin, Elamipretide stabilizes mitochondrial membranes, restores mitochondrial structure, and improves energy production. It also reduces the excess generation of reactive oxygen species, protecting cells from oxidative damage. To be clear, Elamipretide does not correct the underlying genetic mutation in the TAZ gene. Instead, it helps restore mitochondrial efficiency, giving heart and skeletal muscle cells a better chance to meet the body's energy demands. The FDA's accelerated approval for Elamipretide was based on the TAZPOWER trial. Patients received daily subcutaneous injections of Elamipretide and were followed for up to 3 years in the trial. The outcomes were encouraging. On the 6-minute walk test, patients walked about 96 meters farther, roughly the length of a football field. Patients consistently reported feeling less tired. Heart function measures, like stroke volume and chamber size, steadily improved. Cardiolipin levels also improved, supporting the clinical findings, showing that the drug was working at the root of the disease. In short, patients feel better, move more, and show measurable improvements in heart function and mitochondrial biology. The most common side effects were mild to moderate injection site reactions. However, because this was an accelerated pathway, confirmatory trials are still required to prove long-term clinical benefit. Elamipretide represents more than just the first therapy for Barth syndrome. It's a breakthrough in mitochondrial-targeted medicine. For patients and families, it brings long-awaited hope. And for pharmacology and drug development, it signals the start of a new era in treating diseases rooted in mitochondrial dysfunction. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.